I'm Dr. Meher Prasad. I'm a senior consultant in endocrinology and preventive healthcare. I'm basically trained in the UK and in diabetes and endocrine. So I've seen so many people with diabetes having problems, and so I've moved into preventive healthcare so that we can prevent the problems and also at least reduce the burden of these diseases. Um, the seasonal diseases. Hello. Seasonal diseases and the other communicable diseases used to be the biggest burden in the healthcare for in India and many other countries over the world. Hello. So, but this has changed over the past few decades, and with the advent of antibiotics. So I was trained in diabetes and endocrinology. I graduated in Madras Medical College, and I moved to UK, and I've been there. I was there for nearly 20 years, and then I've come back to India um, in 2011. Since then, I've been practicing in Chennai. My area of interest is basically diabetes, endocrinology, but and management of obesity. But my interest has shifted now to preventive healthcare because I see there is a lot of scope for prevention and of these diseases. These diseases are known as non-communicable diseases. But today we are going to talk about communicable diseases like in fact basically infections which were the major cause of death and morbidity in the past few decades. But recently, in the past 20 years, things have changed, and um, non-communicable diseases which we call as lifestyle diseases have taken over, and they've become the most common cause of death throughout the world. So, that I'm going to briefly talk about the seasonal diseases which cause a lot of morbidity and mortality. Recently, we've seen how COVID caused a havoc throughout the world, and which has caused nearly quite even in India, it has caused a lot of deaths and um, throughout the world, it has cost millions and billions of rupees. Um, um, and so we know prevention of these diseases can help save all these money and also the quality of life of people in yeah. So today what I'm going to talk about is a overview of the seasonal diseases which we come across quite a lot in this part of the world. And also it's also quite important for you if you are traveling and due to your work or other reasons. So today I'm going to talk about the seasonal diseases are basically the disease which become more common during certain seasons of the year and in different parts of the world and in India also. So, what are the seasonal diseases? It can be respiratory diseases, which is more common in winter, and vector-borne diseases like the malaria, chikungunya, dengue. So these are all the vector-borne diseases, and gastrointestinal diseases, which is which diarrhea, uh, which could be traveling because of traveling or infections. And this is it's important to know because these sort of patterns repeat regularly year on year. So if we know how to manage them, then we can avoid a lot of illness and absenteeism and um, um, and improve also the quality of life. So if when we see talk about seasonal diseases, respiratory illnesses like flu are more common, and in monsoon, vector-borne diseases where the mosquitoes and other carriers are flourish more in the monsoon season, and they cause disease spread. Similarly, gastrointestinal diseases, which are more common in summer and monsoon because of the water logging, the vectors are they thrive in these moist conditions, and they spread the diseases. Um, and again, as I said, the pattern repeats yearly, and knowing about these diseases and the seasonal variation is important so that we can prevent them, and prevent the suffering because of these diseases. So when you talk about respiratory illnesses, the most common cause is called flu, which we all know about, influenza, and the common cold and pneumonia. These are the most common respiratory illnesses we come across. These are spread by droplets, where when we cough and sneeze, you air we release a lot of airborne droplets, and so it spreads to other people in the close contact, and also spreads to other people because of through direct contact or through indirect contact. So it's important to know about these, because when precautions are taken, these can be avoided, the spread can be avoided, and the morbidity, the troubles because of those things, those infections can be avoided. And these and as mentioned, these illnesses are more common in these months, in the December to February months in India, which is in the winter months mostly. So knowing about these infections will help prevent the infection, protect yourselves, and also prevent spreading it to the other people at work, especially at work, and also in the within the household as well. And next we talk about the vector-borne diseases, which is more common in June to September in South Asia. And so basically, what are vector-borne diseases? These are organisms which um, carry the disease-causing organisms. They are infected, but they do not suffer from that the organisms, but they pass it on to other people. So it carries it from, if you look at this slide, we are talking about a mosquito there, uh, which bites the infected person. So the person is affected, and then it carries the organism. It carries the organism. It doesn't get infected. It doesn't suffer from it, but just carries the organisms. If you see the red mosquito, which is infected, and it carries it from an infected person to a non-infected person. So once it delivers the organism like falciparum and pseudo in malaria, and it delivers it, and it causes the effects. It causes the infection in that person, the uninfected person, and then later on, this person, once he gets infected, he passes it on. It passes it on to other people through the vectors. So as I said, these infections are carried by the malaria, by mosquitoes. Sorry, yeah, mosquitoes, which can cause dengue, uh, chikungunya, and various types of malarias. And these are more common in the rainy seasons. So it's important to know about these and take preventive steps, which I will come later on. prevent it from getting transmitted to other people. And it is also important to know the seasonal, which seasons these are more common, so that we can take appropriate preparatory actions before it starts coming. So this is more common in June to September in the South Asia, and in India, South India, and also throughout the India. So it's important to know about the when these conditions happen and take preparatory steps for that. So next, when you look at the March to May, which is summer and monsoons or seasons, so these during this time, um, there is a lot of floods, and there is a lot of dryness. So when all these the organism there is a lot of water getting contaminated, and unless you take preventive measures, then you can it can be you might ingest um, infected water, food, and that can be transmitted to you and from us to other people. So how do we, what are these diseases like cholera, typhoid, and food poisoning, which causes diarrhea and vomiting? So when this happens, you get dehydrated, and and when you contaminate the food and water, it spreads to other people as well. So how do we, why does this happen? It's because basically because, hello, can you hear me? Hello, கேக்குதுங்களா? Hello?
Doctor, we can hear you well.
We can hear you.
No,
Can
Yeah.
Doctor, yes, Doctor, we are hearing your
Doctor.
audio.
Ah, okay,
Go
okay.
ahead, Doctor.
Right, right. So how do you get these infections? It's because the poor food storing, and also a lot of street food consumption, which increases risk. It's nothing about the food which you consume, but how hygienic they are, hygienic it is kept, how hygienic it is stored. So when you drink water so to avoid these things, you need to drink water from a safe source. Otherwise, drink boiled water or chlorinated. That itself stops the cycle there, so you don't it doesn't spread. For example, if you think about cholera, typhoid, so if you take these precautionary methods, then you stop the cycle. So normally the cycle is infected person contaminates the water, and then you consume it, and then from you it goes back to the other people as well. So when you stop it in your place, then the it doesn't spread and doesn't continue in the cycle and the cycle of spreading. So how do you do that? So one is drinking safe water, which could be either boiled water, chlorinated water. Next is the food, thoroughly cooked food. And then the other important thing is vegetables. It's very nowadays, because of awareness, everybody takes vegetables, fruits. But the important thing is to you might get the healthy benefit out of it, but with that you might also get the bacteria and the contaminant organisms, so causing the infection in yourself. So to avoid this, we need to, in addition to being the cooking, I mean, the vegetables and fruits, you need to clean it properly, and also prevent and then cover it, keep it covered properly, so that if the because the organisms, the mosquitoes and all the flies, if they come in contact with the fruits, then it can cause the infection to spread from other places. So ensure, and then again, these infections are passed on through food and excreta, so which is not disposed properly. So to avoid this, you have to make sure that safe the disposal of the waste food and also the human excreta, so that it doesn't spread from to anywhere else, out of the anywhere else. So always wash your hands to avoid getting infected. Try our own safety is our own safety is also important. So wash your hands before and after the before the meal, so that you don't get infected, and after food also, so that you don't spread any infection you have to other people. And in during the summer during these months, you also need to if you're you need to keep yourself hydrated, well hydrated, and the food with and preferably if you take food, increase the salt intake in the food, that is also good. Salt, like buttermilk and the lemon juice with which is salted. We can also use oral rehydration oral rehydration salts. Comes in pack sachets which you can mix with water and drink. Um, and so if you are infected, and then if you are infected with cholera, typhoid, or food poisoning, so you first thing is you are hydrating yourself with containing salt, so that you don't lose your sodium and potassium and other electrolytes. So that's why oral rehydration salts are very important. So you need to keep that in mind and add salt, and also use oral rehydration salts wherever is appropriate. And similarly, if you are affected by food poisoning, cholera, and typhoid, try not to self-medicate with antibiotics and antidiarrheal agents unless recommended by the physicians, because these antibiotics and will not work against these organisms. So yeah, you're taking these antibiotics unnecessarily and may cause more problems if you take antibiotics, because these most of the time these diseases are self-limiting. And so if you take antibiotics unnecessarily, you might get resistance to other bugs, and may cause resistant infections. So you try not to take antibiotics by yourself unless the physician recommends you. And you will also need, once if the diarrhea vomiting doesn't stop, consult a physician if you have high fever or passing blood in the water, stools, or in the coughing up blood, or if you have intractable diarrhea. So when these things happen, you need to get in touch with your doctor and get in touch with your doctor and hydrate yourself well, and follow the advice given by the doctors, and also take steps to prevent infection spreading. And the other thing, very important thing you need to remember is the children. The children get affected more easier than adults, because the risk of dehydration is very high in children, because the amount of water in the children's body is all based on the body surface area. So if they have a less body surface area, they can get dehydrated very easily. So the water content will be less, and they can get very easily dehydrated. So you need to keep this thing in mind and take appropriate action. So, as we discuss now, the next is we were talking about vector-borne diseases, malaria, dengue, chikungunya, all these organisms we discuss now. So we spoke about how to protect yourself from diarrheal diseases. With regards to the malaria and the vector-borne diseases, first of all, preventing contact with these mosquitoes is the safest way. So how do you do that? You can use the nets for the doors and windows with mesh wire. And the mosquito nets on the mesh, preferably with insecticide treated meshes. So that makes it more difficult for the mosquitoes to reach us. And similarly, in addition to the doors and windows, you could also use mosquito nets around the beds. And it's also very important for babies and children and pregnant women and elderly to people. Uh, so to get prevent them from getting infected. And we could also use indoor residuals, sprays to kill the mosquitoes. And again, personal protection measures include application of the mosquito repellents and using mosquito coils and synthetic pyrethroid impregnated electric heaters and nets can also be used. And wear shirts with long sleeves, full trousers after sunset. So all these things prevent the mosquitoes coming in contact with their skin. So that way you are protected from the mosquito bites. Those visiting, the other thing would be those visiting endemic areas. If you're traveling to African countries or from one area to even within the India, even within the different states, some of them are endemic and malaria is more common there. So when you go there, protection can be used by using drug prophylaxis and drug prophylaxis. The the drug prophylaxis should be used 1 week before arriving to the from non-malarial areas to the malarial endemic areas. So it's important to know about when you're traveling, it's important to know whether the area where you're going is endemic for malaria, and then if so, get in touch with the infectious disease team or consultants and get advice regarding travel. Similarly, when you're traveling abroad, uh, you need to get yourself protected when you're traveling to endemic areas. And when you're and the people, so that is important. And get in touch with the physicians and infectious disease team to protect you to regarding prophylaxis. Yeah. So if the other thing is, you should also be when you're traveling, you should also know if the about the of symptoms of the diseases which you might come across. We say vector-borne disease like and malaria and the other vector-borne diseases like dengue and chikungunya. So that is about the vector-borne disease. Um, so symptoms, if you talk about malaria, and the other dengue and chikungunya, you will come across. I mean, most common symptom is chills, fever, rigor, shivering. I mean, so if that happens, then get in touch with your doctor regarding further management. So next, the other infection which you need to know about is and the awareness is quite less is about hepatitis. Hepatitis is basically the infection of the liver, infection which causes inflammation, which causes the swelling of the liver, inflammation of the liver, and it's caused by different viruses. Most commonly, it's caused by viruses, and there are different strains are there, and they've been labeled as A, B, C, D, and E. And the worry about that is it can cause liver damage and jaundice. So hepatitis A and E are transmitted mainly through the food and water. The precautions we discussed about a few minutes ago, similar to those, similar precautions need to be taken to prevent spread through food and water. And so, as I said, A and E are transmitted through food and water. So if you talk about hepatitis E, it's mild compared to the other strains of viruses, and usually is self-limiting. And similarly, E is caused E virus causes acute outbreaks of jaundice, and these are A and E are usually self-limiting in viral infections. It might take some time. You just need to give supportive management, hydrating yourselves, keeping yourself isolated, preventing it from spreading to other people. And the other thing is, no, there are no drugs as such to be used for these hepatitis A and E virus. It's mainly self-limiting. As I said, self-limiting means these diseases are fought against by the body itself, and it will with time. So you just need to support yourself with hydrate yourself properly, and if there's any temperature, use paracetamol or antipyretic agents, and it should settle on its own. Keep your hydration good, and also the nutrition also very good. So as I said, there are no viral drugs for hepatitis infection. So no, the vaccines again. There is no vaccine against hepatitis E also. So what are the risk factors for these communicable diseases? And as it said, it could be seasonal, climate changes, changes in humidity. So all of them increases the risk of certain diseases, which we discussed earlier. And similarly, poor sanitation, poor hygiene, they are uh, they increase the risk of the spread of these diseases and also severity of these um, communicable diseases. And again, weak immunity also it makes it more prone for makes people more prone for these diseases, um, which mean elderly people, young kids, similarly people with comorbidities like diabetes, heart disease, respiratory infections. So all respiratory diseases, all these people have poor immunity. So these people are more prone for infections. So you need to be careful. They need to be careful when they are traveling and take adequate precautions. Similarly, people with diabetes, obesity, pregnant women, all of them have very high poor immunity, so risk of getting infections. So it's important, as I said, to people with diabetes, obesity, heart disease, and elderly people, people over 60 years. They need to be really careful and take adequate precautions. So, what are the preventive measures that we can take to avoid infections? The general measures like keep hand hygiene, which we all know about these things after COVID, which made us all aware of hand hygiene, and keeping ourselves hygiene. I mean, knowing about, I mean, a lot of awareness about hygiene. So you just need to continue practicing it, whether there are infections or not, so that our immunity levels remain high. And the other important way of improving your immunity is having nutritious food. So that's one important aspect. One second. Yeah. So balanced diet, nutritious diet, and also adequate exercise. Exercise is also very, very important for improving your immunity and maintaining your immunity, and also adequate sleep and sleep. These are all things which reduce your steroid levels, corticosteroid levels in the body, which makes it. Or in other words, when the steroid levels are high in the body, then the immunity levels go down. So that's why it's important to keep the stress levels low by using measures like meditation, exercise, um, breathing exercises, yoga. So all these things can help improve your reduce your cortisol levels and also improve immunity. So so when you're looking at, I mean, these are general measures we discussed about. So if you look at seasons specific prevention strategies, in winter, using warm clothing is very important so that your body temperature is appropriate, and also can also help prevent infection spreading through through the disease vector, insects. So for example, the so in winter, warm clothing and also vaccination. Vaccination is an important aspect in management of infections. Flu vaccination, which is different types of flu vaccines are available now, and now there are the vaccines called Preventive vaccinations. So vaccination for flu and pneumonia are available regular, and it keeps because every flu infection it can be caused by different strains, and they update the flu vaccinations and the strain, and then update the vaccination according to the strain. So you need to get in touch with our infectious disease team, which we have one in our hospital itself, so they can advise regarding travel, and also the type of vaccine which is needed and the frequency of vaccination, and also depending upon your illnesses like diabetes, heart disease, respiratory diseases. All these things reduce your immunity levels. So it's important for you to vaccinate yourself, keep yourself vaccine when you're vaccine updated. It may not be you may not need it, but I'm sure there are elderly people in your families, so they also need you need to advise them and also help them to reach out to get themselves vaccinated and prevent infections happening. Because we'll come to that in the next slide, where uh, how why is important it's important to prevent these infections is more because of the disease. The one, because of the disease itself can cause a lot of um, uh, problems, but also it causes problems to other people in the house, and also it can cause a lot of financial problems. So all these things can be avoided by taking a few preventive steps appropriate time. So and then that is monsoon. In summer, again, um, keeping ourselves hydrated well itself prevents a lot of problems. Like, if you get dehydrated, again the blood circulation can be affected and the immunity can be affected as well. So keep yourself hydrated, and then avoid street foods, and also, if you I mean even if you take it, make sure that it is clean in the clean area, and also that they follow adequate healthcare measures. Similarly, the government also takes healthcare initiatives. So it's important to know about these campaigns in the communities and get yourself vaccinated appropriately for flu, typhoid, hepatitis, and the sanitation and vector control programs, where the water bodies, they try and disinfect them, may use medicines to do that. So you should be aware of that and make use of that, and also get people the local bodies to help them in keep them uh, get them to do the control programs appropriately in your areas. So that is the uh, community responsibility. Now, each of us have our own individual responsibility to practice self-care. Um, Preventing, like for example, hand washing, and then before and after food, before and after going to hospitals, and where and then so that is so things like that. You have to take initiative to do all those things, and then see get medical help early rather than late, because the earlier we do that, the easier the problem. The problem can be tackled easier with less time and more effectiveness. Similarly, the vaccine clinics, as I've been telling, is an important resource which you can use. Um, and most of the hospitals, in fact, MGM has one. And similarly, wherever the physicians will be aware of I mean, they might be aware of these vaccination schedules. If not, get them. You can get in touch with us, and we can help you. Thank you. Any questions? So you, as you said, non-communicable diseases are causing the most is the most common cause of death in the throughout the world and in India. Um, Through the cardiac, I mean, cancer is, I mean, cardiovascular disease is the main cause of death, and all the metabolic syndrome problems increase the risk of cardiovascular disease. So that's the reason we need to work on reducing the metabolic syndrome. How do we do that? Well, the bottom line is, as I said, obesity is the root cause, and then it works through the insulin resistance, which causes diabetes, and it further leads to cardiac problems. So, how do we tackle this? First, the lifestyle changes. Those are the underlying, yeah, that is the major cause for all the changes in the life change. Yeah. So this is, can you see my slide now, madam? The non-communicable disease like obesity, hypertension, dyslipidemia, and then the fatty liver, non-alcoholic fatty liver disease. All these things group into these are all a group of problems which we call as metabolic syndrome. The problem with this, the why it is dangerous is it increases the risk for cardiovascular disease, and then also increase the risk for, I mean, the causes the head death. So if you look at the and then similarly, it also causes it has also increase in risk, and then this also increase the risk for mental and cognitive health problems. So when we talk about metabolic syndrome, the prevalence as of 2025 is 1 in 9 people around the world have diabetes, but okay. Yeah. So as I was telling, the metabolic syndrome, these are a group of problems which increases the risk for heart disease. The main thing is type 2 diabetes, obesity, high blood pressure, high cholesterol, non-alcoholic fatty liver disease. So and insulin resistance. So insulin resistance is when you have insulin in the body, but it doesn't work properly. So when that happens, the insulin levels soar up. So to get the sugars under control, the body has to produce more and more insulin to keep the sugars under control. The problem with very high insulins is that all the carbohydrates which we eat and everything will be stored in the liver and other cells, and also in the adipose tissue, in the fat tissue, because of the high insulins. So you will whatever you carbohydrate you eat, it will get stored in the liver and other areas where fat is stored, and it causes the because fat is it produces a lot of um hormones and adipokines and other chemicals which can damage the various organs in the body. So that way, um, this metabolic syndrome affects the body, causing increasing the risk of heart disease. And as I said, mental health is also an important problem nowadays. Um, and the and it's When you talk about the NCDs, they over it's over 40% of the 40% of people are affected with metabolic condition, and the 40% of the people will remain are undiagnosed. So that is a big problem, because if you know that you've got metabolic syndrome, then we can treat them. We can take appropriate steps to prevent the complications of that. But 40% of the people are not are undiagnosed. So that is a big problem. And again, the final bad thing is that it causes premature mortality, and nearly by 75%. So it increases the risk of premature mortality by 75%, and it is the cause of death for nearly 75% of the people. So it has overtaken, the cancer as a cause of death. So so it's important. But the good thing about these things are these are all reversible or preventable. So the what happens to the in the metabolic syndrome is can it causes organ damage, reduces the immunity, and also causes systemic inflammation. I mean inflammation in the body, which can cause accelerate the risk of increase the risk of cancer and also aging. So that's how the metabolic syndrome affects the body and also increase the risk of death. So the other important, as I said, prevention is we when we come to the question of prevention, it's important because if you prevent if you pick up the metabolic issues earlier in the earlier, it's easier to reverse it, and it's through lifestyle changes itself it can be reversed, and also the cost effectiveness when you call the investing in the healthy food, gym membership, and all those things far easily outsets the long term cost for heart surgery and other complications like dialysis. For example, if a person with diabetes progresses towards dialysis, the cost of management goes up by nearly 100%. Not 100%, so 100 times. So, for example, if he is spending 1,000 rupees per day for diabetes management, if he gets into dialysis, then the cost become 1 lakh nearly. So, the 100 times it goes up. I'm just giving you a rough example. So that is the effective, that is the increase in the cost we see. Or in other words, if you prevent person going in for dialysis by at least a year or 6 months, you can save that amount of money. So that is important. And also the lifestyle changes are very important because that's what makes the improvement in the metabolic problems sustainable. You can do changes, lifestyle changes for a day or a day, a few days, but that's not the effective way of doing it. And similarly, drastic changes, the diet changes, you might go in for, only no carbohydrate diet, high protein diet, starvation diets, all those things, different fads you can do for a few days, but that is not sustainable. And what we need is a sustainable lifestyle change, like regular exercise, sustained carbohydrate reduction. So, for example, if you're eating 4 idlis or something like that, even a small change like reducing by one idli, so four, it means three instead of four, and a small, if you're taking half a cup, 1 cup of rice, may reduce a quarter of it. So take three-fourth of it instead of 1 cup. So like that, very very small changes, throughout the day, morning a little bit change, lunch, dinner, every place small changes, and having healthy snacks, low calorie snacks in between helps in maintaining the lifestyle changes, and through diet and regular exercise. Again, exercise done not once in monthly like that. Every day, small some exercise. At least 5 days a week, you do some regular exercise up to maybe an hour a day. So those things are all changes which is going to help in the long run. And as I said, reversibility. For example, if a person has got diabetes, if you don't do changes, they can go in for I mean, if they got pre-diabetes, if they don't do lifestyle changes or adequate intervention, they can go in for diabetes in a few years' time. But if you do the changes, lifestyle changes, and sustain it, they might be able to remain in normal sugars, or even pre-diabetes without going for diabetes. so so that is the effectiveness, of early intervention, and that's the effectiveness of the how we can reverse the uh, metabolic syndrome problems. And again, cost effectiveness we said, and sustainability also we discussed. And the as I said, yeah, economic burden. So personal, the when we talk about economic burden, we can talk about it in three, I mean, different levels, like personal cost, national, at an state level, or in the national level. So each for personal, because in India we all spend ourselves for the health healthcare most of the time, and of course government helps a lot, but we most of the burden is on ourselves. So through if you have diabetes, for example, it's for lifetime if it is not controlled. So if you need lifelong medications, insulin, or frequent visits to the hospital. So if you reverse it, or do the appropriate lifestyle changes, so you may not spend that much, or it may reduces the risk, expenditure for the management treatment. Similarly, the government spends so much of money on chronic diseases, especially abroad, so on infrastructure and education. So that can also be reduced. That will also have a big impact if it is appropriately delivered and also used. And next, for the offices and companies, it has impact on the workforce productivity. So metabolic diseases increase. I mean, if say for example, if you have diabetes, which is uncontrolled, they can increase the absenteeism, the number of days people are absent, and so again the effectiveness of they call it as presenteeism. They are there, but they are less protective. So that's where the improving your health condition, or whichever problem you have, reduces the absenteeism, and also increases you to helps you concentrate on the work you're doing and do it better also. So that way it improves the workforce productivity, and also on the impact, it has a big impact on mental and cognitive health. So there, of course, there will be some direct brain connections, like insulin resistance is linked with higher risk of Alzheimer's and cognitive function. So in addition to that, mood disorders. I mean, any chronic disease is a thing which can make people depressed. There is no, I mean, this is not rocket science, because they have to live with the disease every day, day in and day out, throughout their life. For example, if it is diabetes, so it brings them down, unless you're Superman, or we were super excited all the time. But it doesn't. It's not practically. Depression is a big problem, but keeping your health under good control can avoid that, or it reduces the intensity of that. So of the disorders. And the other important thing, most important thing, is quality of life. So reduce mobility, being tired all the time, social isolation, all those things make and decrease satisfaction in the quality of life. So all of those have a major impact on the livelihood of people, not like the lifestyle of the people with chronic metabolic problems. So, avoiding that or reducing the severity of the metabolic disorders will have a big impact on the quality of life, not only for the people but also people surrounding them. For example, if a father has got diabetes, and then the son's the quality of life also can get affected. They have to take them to the hospitals, they have to take leave. So like that, it affects the whole circle of people. If they get ill, the whole family is down. So it does affect the whole family and reduces the quality of life of the people. So to improve that, keeping the sugars under control, keeping the the illness under control, plays a major role in improving the quality of life of the person and also the family as such and the community as such. So we discussed about the cost effectiveness and also the sustainability of the um, lifestyle changes. Um, so any yeah. So in summary, prevention. Uh, so the lifestyle changes helps. Lifestyle changes and prevention saves lives, protect the brain, and also the financial and the stability of the family. And your health again is not, as I said, it's not an investment. It's an investment, but not an expense alone. And family choices compound into a lifetime of wellness. So it's to implement to get the best benefit of all these interventions, you need to implement very small changes on a consistent basis for lifetime. For example, even if and for that you need to start off somewhere. Start very small, like for example, 15 minutes of day walking is easily done. So we can start off that way and then build it up. So the more you win, then you feel better and you can implement bigger changes and bigger and bigger changes and maintain your lifestyle and lead a disease-free life. So one of the main important aspects of the maintaining good health is regular health checkups, so that you keep track of your problems. So you avoid, if there is any deviation, act on the if you when you're going for regular health checkups, you're meeting your doctors